There was a time when all patients with schizophrenia were treated in large institutions. Today, most patients with severe mental illness, including schizophrenia, are treated in the community. But how did we get there? Let's take a look at the history of care in the community for those with schizophrenia. The first part of this story begins in the 1950s with a treatment called rezapine and insulin. Coma therapy. Rezapine is derived from the Indian snake root plant and was used for centuries in medicine to treat mental health conditions. It was only until the 1950s that it was found to be effective in reducing the severity of psychotic symptoms in schizophrenia. However, rezapine has significant side effects, including extrapyramidal side effects, which can include tremors, muscle stiffness, and involuntary movements. But despite these side effects, it was still widely used until the introduction of the phenothiazide. In 1955, there was a groundbreaking discovery of a new class of antipsychotic medications that were much more effective than rezapine. One of the first phenothiazines quickly became the most widely used antipsychotic medication, and remained so for over 20 years. These medications were revolutionary because they were able to reduce psychotic symptoms without the severe side effects of the older medications like rezapine. As these medications became more widely available, patients who were previously confined to large institutions could now be treated in smaller community settings. However, it was until the 1960s and 70s that these medications really started to be used effectively in the community. This was due to a number of factors, including the development of community mental health centers, the deinstitutionalization movement, and the introduction of new antipsychotic medications like haloperidol. During this time, there was a growing recognition that institutionalization was not the best course of treatment for most people with schizophrenia. In fact, it was having the opposite effect. Many patients were being discharged from hospitals and were then left without adequate community support. This led to high rates of relapse and hospitalization. So the solution was to develop new medications that could be used in the community to prevent relapse. And this is when depot medication was developed. Depot medication is a form of long-acting antipsychotic medication that can be injected once a month to prevent relapse in patients with schizophrenia who are living in the community. This was a huge breakthrough because it meant that patients no longer had to be hospitalized to receive treatment. They could continue to live in the community and receive the treatment they needed to manage their illness. Depot medications are usually a type of antipsychotic. Typical antipsychotics work by blocking the action of dopamine in the brain. Dopamine is a neurotransmitter that is involved in a number of important functions, including the control of movement, motivation, and reward. By blocking dopamine, these medications are able to reduce psychotic symptoms like hallucinations and delusions. Some examples of typical antipsychotics: fluphenazine and perfenazine. However, typical antipsychotics also have some significant disadvantages. One of the most common side effects of these medications is extrapyramidal side effects. As mentioned earlier, these are side effects that affect the brain and nervous system and can cause movement disorders such as tremors, muscle stiffness, and involuntary movements. Another disadvantage of typical antipsychotics is that they only work in about 2/3 of patients. This means that there is a significant minority of patients who do not respond adequately to treatment and may require additional treatment options. For those who don't respond to treatment with typical antipsychotics, there is always the option of atypical antipsychotics are a newer class of antipsychotic medications that have a different chemical structure than typical antipsychotics. They also have a different mechanism of action and are more effective in treating the negative symptoms of schizophrenia. Some examples of atypical antipsychotics include risperidone. While these medications are generally safe and effective, they do carry a risk of metabolic side effects, meaning that they can cause changes in weight, blood sugar, and cholesterol levels. This is why patients taking these medications need to be monitored regularly for these side effects. So, what does the future hold for those with schizophrenia? Hopefully, we will see the development of true third-generation antipsychotics that are even more effective and have fewer side effects. But until then, we will continue to use the second-generation antipsychotics and other treatments to manage this complex and challenging illness. If you found this video helpful, please let me know in the comments below. And if you want to learn more about schizophrenia, please check out my other videos on my channel. Thanks for watching.